Good afternoon. My name is Joanna Wardlaw and welcome to this session of ESOC TV. This afternoon we're going to be concentrating on reducing the burden of stroke and hearing about the patient and provider perspectives. So first I would like to introduce my co-chair, Dr. Simona Sacco, also upcoming president of ESOC. Simona.
Hello, Joanna. It's my pleasure to be here and to have this discussion on how we can reduce the burden of stroke, and we have the invaluable contribution of both patient representatives and care providers. So welcome everyone. We have Diana Wong. She is a patient representative. She's online via Zoom. We have Arlene Wilkie, CEO of the Stroke Alliance for Europe. Welcome. We have Melinda Rolsen. She's the Chief Operating Officer of the Stroke Action Plan for Europe. And we have Diederik Dippel, the Chair of the ESOC Stroke Unique Certification. So welcome everyone.
So thank you. So first of all, we'd like to hear a little bit more from the patient perspective. So Arlene, perhaps I could hand over to you and we can hear a bit more about Diana's personal experiences.
Of course. Thank you, Joanna, and thank you, Simona, for the introductions. Diana, hello, how are you?
Hi, Arlene.
Hi.
It's so nice to see you.
Good. Where are you today, Diana?
I'm at home in Sintra. I live in Sintra, Portugal. You should all must come to Portugal and visit me sometime.
I thank you. And thank you so much for joining us by Zoom. We really appreciate it. Diana, we just wanted to talk to you a little bit today about your stroke and about your experience. Is that okay? And do you want to just share maybe just a little bit about your stroke experience with us today?
Yes, I can resume my story. I suffered a stroke when I was 34 years old, 12 years ago. And I worked as a journalist, but I consider myself an healthy woman. I already have two children, and from 1 minute to the other, my life changed drastically. 1 minute I could stand by myself and do things, and the other minute I was lying on the hospital bed. My husband was feeding me. The nurses were around me to change me my diapers, and I couldn't walk or even sit on the bed. And I had to learn everything. And then when I said everything, it's really everything from the beginning till now, because a stroke survivor has to learn. I had no communication problems, but sometimes some stroke survivors have to learn how to talk and how to write. I had no issues about that, but I couldn't move my right side or my left side. Now I have hemiplegia and I don't move my left side for my activities. But now I can walk by myself. I don't use a wheelchair. I drive an adapted car. I was even I had even a third child after I suffered a stroke. So it's been quite a journey since 2011 till now, because I so many challenges for me and for other stroke survivors to deal about rehabilitation.
Thank you, Diana. I think it's a difficult story to hear, and thank you for sharing it, and your passion for sharing your story really does shine through there. Could you also tell us maybe a little bit about what went well during your journey, and maybe what could have been done better to have made your life better after your stroke? So what went well, and what could have been done better for you during your journey?
Yes. when I suffered a stroke in the acute phase in 2011, there was a thing called the green way of stroke in Portugal. But unfortunately, when the fireman came to my house to see what I was having, I was lying on the floor crying, and my husband was saying, she doesn't move her arm, she's talking funny, I think she's having a stroke. They thought, no, this is anxiety, maybe she's panicking, and this is not stroke because she's very young. And they failed, okay? But when I arrived at the hospital and I had another convulsion, and the doctors really see that I was having a stroke, that I was only 34, but stroke doesn't only happen to older people. Sometimes children have stroke. And I think it's the most important, and it was very important for me, to have access to a rehabilitation. Since the first day at the acute phase in the Hospital de São José, I had access to a physiotherapy. I remember I couldn't move, I didn't see with my left eye, I couldn't move anything. I was crying and I couldn't wipe my tears with my right hand. And I remember the physiotherapy telling me to think about the movement and to try to do something as simple as this, as counting the numbers, okay? Counting with my fingers. And I couldn't do that. I was thinking about it, but I couldn't do this. I can't do this with my left hand, but with my right hand, I can now. And I think it's the most important for us stroke survivors. There are no medicines that would go to the chemistry and buy some medicine. No, you have to have access to the rehabilitation. And if it is for the lifetime, so it is. It's not only first year after the stroke or maximum 2 years after the stroke. No, I have to do physiotherapy for my life, for a lifetime, because stroke survivors suffer from something called spasticity that causes pain, and that if you don't train and if you don't have access to rehabilitation, you could get worse and get another disease, and you have to do secondary prevention too. And I think it's the most important for us is to have access to not only a rehabilitation program, but also to a family doctor. I don't know if it's like that you mentioned, but in Portugal, every family should have a doctor that knows everything about your family and accompanies you that from the childhood till you are older. And it's very important for my family doctor to know how are my blood pressure, how is my cholesterol, how I am feeling, if I am doing rehabilitation, and I talk about that with my family doctor.
Yeah, thank you. Diana, thank you so much for your story and for sharing the ups and downs and how you've pulled through your situation to become such an advocate for stroke survivors. So thank you very much for sharing your story.
A wonderful lesson in all the things that need to be addressed in stroke. Arlene, I wonder if you can say a little bit about SAFE in general and what you're trying to do as an organisation for patients across Europe.
So SAFE is the Stroke Alliance for Europe, and what that means is we are a membership organisation, and our members are stroke support organisations in the different countries. So those stroke support organisations provide that element of support, care and information for stroke survivors and their carers after they've had their stroke and maybe left hospital and maybe feeling a little bit vulnerable, not sure how to get back to work, not sure how to get back into education, not sure how to get back into society. They need peer-to-peer support, they need help, they need support. And that's what those support organisations do, and it's critical that they exist in each country and that they're there as part of the journey of that stroke survivor. So we have the medical care, which is provided, but also we have that societal view as well to help get people back into that world of living again. So what we do is we listen to what our members tell us, and we then try and do more advocating, policy, talking to people to raise awareness of stroke throughout Europe. And a crucial point is the life after stroke that Diana's just been talking about there, is about how important it is that we talk to our national governments and at the EU Commission if possible, about how important that is to make sure that the wonderful job that is done by our neurologists to save a life through all these amazing clinical trials and that we're talking about just now, we're saving lives. But we must make sure that life is a quality of life afterwards. So that's what we're here for. We're here to listen and do more about raising awareness about stroke and the importance of life after that stroke.
And I think it's quite a popular misconception that stroke doesn't happen in younger people. There are other misconceptions as well. And I suspect that it often helps to hear from affected individuals about these misconceptions. And that was beautifully articulated by Diana. I mean, that's obviously an important role also for SAFE to provide this advocacy opportunity as well.
For the stroke survivors. Yeah, no, absolutely. And I know Diana wouldn't mind me saying, but you know, she's a shining example of maybe somebody who maybe wasn't so confident in the deep and distant past about presenting, but is now, and she's a very confident presenter about her story and her situation, and isn't scared to stand up and speak for what's right for her, and I think is a great inspiration to others. Yes. And we need to make sure we have more stroke survivors in all our work, so that our health ministers, our policy and public affairs people who are our health, who are our hospital directors, they hear from those patients and survivors to hear what needs to be done.
Yes.
They're the ones that use those services and can tell you what it's like to be a user and of the service. We need to hear from them more. So yeah, we look to our stroke support organisations to give us more stroke survivors like Diana who are willing to share their story. They are the most influential people you can have round a table. Is someone that's experienced and is using the services.
Really true, and their voice can really make the difference.
Absolutely.
So Simona, ESO has been instrumental in the Stroke Action Plan for Europe. I wonder if perhaps you and Melinda would like to tell us a little bit more about that.
Yeah, so Action Plan for Europe, it's one of the flagship program for Europe. It's a program that has started in 2018 and has a very ambitious aim to reduce the burden of stroke by having at national level a well-organized program, a plan, a system to track the system of care for stroke. And Melinda is contributing a lot to this program. She is now the Chief Operating Program of the Stroke Action Plan for Europe. And maybe she can tell us a bit more about the medium term and also the more immediate priorities of this action plan.
Thank you so much, Simona. Yes. So really, the top priorities for Stroke Action Plan for Europe now is to get fully funded stroke plans in place that encompass really the stroke care, the whole chain, from prevention through acute stroke to rehabilitation to life after stroke. And so this is really our top priority. And also, I must say, Stroke Action Plan for Europe, it's a teamwork. We have 52 countries on board with 97 national coordinators that are really working hard to get the contact with the government bodies, with the health ministries to succeed in getting a signed declaration. And this is really a work that has moved forward lately, and we are getting more and more signed declarations in, and this is, I think, really impressive by the national coordinators because they are, what can I say, really busy clinicians, neurologists, and to achieve this, it's really hard work, and here the stroke support organizations are extremely important because they can really voice the personal experience and really have another perspective of the importance of this whole chain.
Melinda, can you share some of the success you have achieved with this program?
Yes, thank you. Yeah.
Give examples.
Yeah.
So the signed declarations are a definitive success, and so I like
How
to
many
highlight
signed declarations
that. I
we have so far?
believe we have maybe 12 now. Yes,
Yes,
that's
good.
just one ticked in the last week, so that's wonderful.
Romania?
Yes, that's true. And also, I really believe that to put it in perspective, that we have the numbers that it's 872 million inhabitants in Europe that have a dedicated national coordinator in the Stroke Action Plan for Europe. I think this is, it puts perspective to it, actually, and I believe that is a success, this teamwork. And definitely.
And I imagine you had also some problems, some challenges, difficulties. Can you tell a bit more also to understand how we can collaborate together to overcome those difficulties?
Yeah, so of course this Stroke Action Plan, as you said, was started in 2018, so it has taken years to actually establish this good relations, and it takes time, and it's a work that we have to do together to succeed. And I really believe that spreading the word and raising awareness is extremely important in achieving these targets that we have set for ourselves in the Stroke Action Plan for Europe. So I just feel that yes, there are a lot of challenges, but this team spirit is really there, and it's building, and it's been a wonderful process.
Thank you.
Speaking of working together, something else which ESO has done is you have a special committee looking at stroke unit certification, and we're fortunate to have the chair of the stroke unit certification committee here, Diederik Dippel. Can you tell us a little bit about the work of that committee and how it can interdigitate and how ordinary people on the street of ESO can help make this happen better?
Yes, well, the committee is on stroke units and stroke centers. We make a distinction between those two, and we're actually working on a 3-level certification. That's primary stroke centers, thrombectomy capable stroke centers, and comprehensive stroke centers, just like the Joint Commission in the USA does. It's more complete, I think, and you have to. There's a discussion about what is a stroke unit. Even this morning at the Precious trial presentation, there was a discussion about it. And what we say, it's a dedicated area in a hospital, part of a ward, complete ward, with trained professionals, professional medical personnel, not only doctors, but especially nurses, stroke nurses, and stroke paramedics. They should be trained, and they should be trained every year, every 2 years, and sometimes we forget that. And they should have protocols, that's an essential part, and they should collaborate with several other specialties, cardiology, rehab, physical therapy, and they should be able to do good stroke workup and treat with thrombolytics. That's the basics of a stroke unit, and they should have the ability to do follow-up. I think and there's a link with the Stroke Action Plan, I think. Yes.
Have you ever been in the position where you've been asked to give a certificate and you've not been able to because whatever the unit was didn't meet your criteria? Yeah. And are there typical things that people fail on, or that they just need to give more thought to?
Yeah, that's what we see. Some hospitals have done work on getting their stroke unit operational and did a lot of good things, but then stopped working on it. And sometimes the head of the stroke unit is a neurologist specialized in inflammatory disease. That's not the way we want it.
No.
So it should be clear that someone is involved in stroke and does a little bit of research by participating in clinical trials. You don't have to do it yourself, but participate and do training of your personnel.
Okay. And several of the points that Diana made actually relate to sort of early initiation of rehabilitation processes, and then the fact that actually this is a disease for life and it goes on a lot longer, and now you are 12 odd years out from the original event, and what are you doing now to try and extend out, if you are, the certification process into more long-term
Yes, we are looking at
implications?
you're being certified for 5 years, and then you have to reapply, of course. And I think you have also you should have responsibility for the complete stroke workup from home until always.
Forever.
So forever. The chain should be you should look at the chain and keep that in order. That's important. So also your ambulance personnel and also your GPs in your region. And you should look around you and look if there's patients that are not going to a stroke unit but to internal medicine in a small hospital around the corner. That's not what we want.
And from your perspective, have you spotted inequalities across Europe in availabilities and the level of those stroke units that
we don't have
ask for certificates?
Yes, we know that in some countries the rate of thrombolytics and the rate of thrombectomies is quite low. But we don't say you need to do so many percent of your patients. That's a too strict criterion, I think. But you do need to do a certain number just to keep your experience going.
Okay. So just opening up the discussion, and Diana, please perhaps speak out too if you want to say something. Here we have the opportunity at ESO, a large group of people, and we continue to collaborate throughout the year, and with SAP-E and SAFE, a lot of opportunities. What do people feel would be very, most helpful, or ways in which individuals can help to move things forward so that outcomes become better and we can even reduce frequency of stroke in the first place?
I've got lots of ideas.
Speak.
I would say the first thing they should do is read the Stroke Action Plan for Europe. I think they should read the document, the scientific document that was published in the European Journal all those years ago. Read it, get enthused by it, get in touch with the national coordinators, get in touch and say, I want to work with you. Also look around and see what stakeholders maybe are missing from the group. So as you said, there may be GPs missing, there might be allied health professional groups missing. It's really important that we're not just thinking about neurology and acute care. It's the whole, as we said, it's the whole journey. So find those missing stakeholders, involve the patients, involve the stroke survivor voice, but find the cause. Find the problem that you want to solve in your country. And I've got a good example, if I could give you a really good example. Coming back to Portugal. They're a really good example where they've got 5 national coordinators from what I remember. 3 are from the Medical Scientific Society and 2 are from the Stroke Support Organisation. So it's a really good collaboration. They have signed the declaration as far as I recall. Is that right, Diana? You've signed the declaration, yes. And now working towards a stroke plan. And they came to SAFE and they said, we really want to focus our government's attention on rehabilitation and life after stroke. So they set up a parliamentary meeting maybe about 6 weeks ago, Diana, and we all went along. We talked about the Stroke Action Plan, we talked about acute care, but we also focused on rehabilitation and life after stroke and the need for that as well. So that for me is a great example of medical stroke support coming together, finding a cause and an issue, but then also taking action and actually going to the ministries of health and having that group session to say, these are the problems, what are you going to do about it? So that was, for me, a really good example.
And if I can add, it's if we want to influence the politics, especially at the EU level, it's very important to find synergies with other parties that may share a similar interest. And this is what we are trying to do within ESOC. We are working together with the European Academy of Neurology and the each European Organization for Cardiovascular Health in order to speak as a common voice so that all together we are strong and we are more heard.
Yes, it's important to find, the common ground, and the voice becomes stronger when we are together.
I was wondering, we've quite well defined what a stroke unit is and what it's doing, but rehab, that's a different story.
And life after stroke.
Yes.
Yeah,
We don't know what the minimal requirements are.
So we may need to also help our national coordinators with that. And I also would say for the ESO members that also research. So today has been a lot of research around acute and about the amazing stuff that's happening in hospital. That's great. We also now want you to look at, okay, let's look at rehabilitation. Let's look at life after stroke. Let's make sure that the wonderful job you do to save a life is then we're seeing new research and it's sustainable with new research and new guidelines being written for life after stroke. So I would call for new research as well.
Diana, maybe she wants to join and add something.
I absolutely agree with everything that you said till now, and I am one of the national coordinators of the Stroke Action Plan in Portugal, and I was involved also in the part of the life after stroke, in the building of the Stroke Action Plan, in the part of the life after stroke. And I'm always open to work with other patient advocates that want to improve the life after stroke and the access to rehabilitation for us stroke survivors.
Okay. I would definitely share the impression that there's a lot of focus on the hyperacute and acute end, quite rightly.
Yeah.
However, there are other types of stroke, and there are, lifelong problems after stroke which probably do not receive in fact, they don't receive the degree of attention that they should do, and perhaps we need to elevate those more in the sort of lexicon of interests across stroke, and perhaps there are ways in which ESO could encourage that even. So I'm conscious of time, and we're getting close to the end. We've got a busy day tomorrow. Is there anything that you're particularly looking forward to tomorrow?
Yes, there are a lot of sessions looking forward tomorrow. We have plenty of scientific sessions. Just to mention some few, we have a session on basilar artery occlusion, one on secondary prevention, on neuroinflammation and thrombectomy, but there are many others. And then there's the Presidential Symposium Awards and the large clinical trials. Together we had the very important clinical trials presented, and tomorrow we will have other one. Just to give some anticipation, we will have a REACH trial focusing on min-invasive surgery for the intracerebral hemorrhage. We will have the Interact 3 on the impact of the blood pressure lowering strategies in ICH, the precise MRI, a groundbreaking investigation in the prevention of ischemic stroke in patients with carotid stenting, and many others. So see you tomorrow.
Well, thank you very much, and thank you very much to our guests and also to our patient representative for joining in this session, and thank you for your attention.
Thank you.
Bye.